Sharista doctor, I am starting your 2 minutes time.
Right, ma'am.
Started, okay?
Yes, ma'am. And next page, ma'am. Any other page, ma'am?
No.
Can I start, ma'am?
Last 40 seconds, you can organize yourself. Started your time.
Hi, I'm Dr. Shaisa, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yeah, I am Sadia and I am 26-year-old.
Sadia, is it okay if I continue the consultation or do you need the interpreter?
No, doctor, it is okay.
Mm-hmm. I have confirmed from your GP letter that you are pregnant and you want to discuss your report. Am I right?
Uh, yeah, I am here to discuss the report actually. I am
Mhm.
being in the ward, doctor. I am being admitted.
All right. So, may I know the reason of admission?
Yeah, actually, I am having this excessive nausea, vomiting. I had a previous bouts also a week back, and then they had given me certain medications. But in spite of taking those medications, I was having severe nausea and vomiting, and that's the
Um,
reason. And they had offered me admission, and now the junior doctor has arranged some ultrasonography report.
yeah, I'm so sorry to hear about that. No worries. I will discuss your report in a while. But before that, is it okay if I ask you a couple of questions to know more about you? So finally, we can read to self-acceptable and mutually agreed management plan.
Yeah.
Mm-hmm. Could you tell me more about your pregnancy?
Oh, yeah. Actually, this is my planned pregnancy. Me and my husband, John, were looking forward to have the baby since last 3 years. We have been married and we were planning. And yes, ultimately, I got pregnant.
So
And
how
I'm
far
looking
you are
forward.
in this
Yeah.
pregnancy?
I'm 12 weeks from my last period.
Have you started folic acid?
Yeah.
And what about your booking blood tests and scans?
Yeah, they're due, doctor. The
Okay,
booking blood tests are due. The scan is there here.
okay. All right. May I know the reason for late booking?
No, I was booked very early. This is now I am due 12 weeks now. So now within a 1 or 2 days we are going to go ahead with the blood test.
Okay, okay, I understand. So, how is your vomiting now?
Oh yeah, it has been better off.
So, any other complaint apart from that, like tummy pain or bleeding?
No, no, no.
Mm-hmm. So, when was your last menstrual period?
12 week back.
Do you follow your GP for any medical problems?
No.
Any surgery in your tummy or down below?
No.
Are you allergic to anything, Sadia?
No.
Do you smoke or drink alcohol?
No.
Pardon me for asking recreational drugs.
No.
Any family history of concerns or twins in your family or clot in the leg or lung in your family?
Too many questions at a time, doctor.
Uh,
Uh,
mhm.
yeah, my sister is having twin babies, and they all are grown up now. They are a 12-year-old and they're grown up.
All right. So I just want to know, is this your natural conception or did you conceive on medicines because you were trying for a longer period?
No, actually, I was trying, but this is my spontaneous conception.
And how is the support at home
Yeah, me and my husband both are staying together, and the support is very good.
and your BMI,
It's normal.
your blood group?
Uh, I have 8 to do, doctor. Now they will be offering me.
Okay, no worries. We will check. No worries. Uh, do you feel yourself like depressed or you are having a lack of interest in your
No,
household?
no way.
That's good. Thank you very much for the information. Would you like to add anything else, Sadia?
No, doctor. One more thing. My parents are having diabetes and high blood pressure.
Okay, so what was your blood pressure and um,
I
sugar?
don't know. I
Well,
don't know. No,
okay,
I don't know.
okay, no worries. We will check. No worries. Okay, I would like to check you in the presence of chaperone. My nurse will check your general well-being, and I will check your weight. And may I know, do you think any change in your weight in last couple of days?
No,
Okay. Okay, Sadia, now come to your concern. I can see you are alone today. Would you like someone to be with you because I have to give you a lot of information about your
it's scary,
report?
doctor. Is it scary?
It is not scary, Sadia, because I would like to give you a lot of information. Maybe sometimes it is difficult to understand. That's why.
No, doctor, you can go ahead.
Okay. So, can I check my second page? I have confirmed your name, age, and your NHS number on your report. This report belongs to you. I'm making for the better understanding. I would like to draw the picture. See, uh, th- these are two sex, and there is one after birth. Um, I would like to mention you that you are having twin pregnancy, and this is monochorionic diamniotic. Have you ever heard about that?
Oh my God, that means I'm carrying the twin babies. Oh, that's really great. I'm really
Yeah,
feeling excited.
yeah.
But I haven't heard, yeah, I haven't heard about this kind of twins. I have just heard about twins. And the only knowledge I do have about twin is whether they are the similar one or identical one or non-identical one.
Yeah, this is monochorionic means I would like to explain you in a detail that both babies are in different rooms, so they are the six, and they are sharing the common kitchen. That is the afterbirth. So that's why there is one kitchen, and both are sharing the same kitchen, but the rooms are different. Am I clear so far?
Okay.
Okay.
So
So
they are, that means they are identical or not identical.
they can be identical and they can be unidentical. There is a possibility of both means they can be with the same sex or they cannot be with the same sex. Okay,
Okay, so they might, okay, so I can have a combination of boy and girl also.
there is a possibility and there is a possibility of boy and girl, and it may be girl and girl or boy and boy as well. Okay.
Okay. Hmm.
uh, and moreover, as this is a high risk pregnancy, so there is a need of vigilant monitoring. So in view of high risk pregnancy, you will be managed by our special team of health specialists, including my consultant, the baby doctor, the fetal medicine unit, that is a specialized unit for the monitoring of such kind of pregnancies. And we will involve the specialized midwife, specialized nurse, GP, and support groups as well. Are you with me so far, Sadia?
Oh, yeah.
So there are some implications on the mom and the baby with this kind of pregnancy. mom could be at a higher risk of, we can say, high blood pressure, proteins in the urine, sometimes high sugar level, clot formation in the legs and lungs, and sometimes delivery before due date, and sometimes cesarean section as well. And for the baby, Sadia, baby can be at higher risk of early pregnancy loss and sometimes some structural problems, but the possibility is very rare. And there is a possibility of delivery of the baby before due date, and sometimes one baby is big, and sometimes other baby is small in growth, which we call selective growth restriction. And there is a common complication that is twin transfusion syndrome. Have you ever heard about that?
No, I don't have any idea about it.
Yeah, in this case, one baby is getting more blood supply and other is less, and in because of that, even one baby can die inside the womb because of this complication. I don't mean to scare you, but you will be managed by our expert team of doctors, and there are some strategy measures to reduce all these complications. So, as you are 12 weeks pregnant, so I believe you already started the folic acid.
Oh, yeah.
Mhm. So I'm going to start aspirin. This medicine will reduce your risk of high blood pressure and proteins in the urine. I'm going to start vitamin D as well. I will send your booking blood tests as you told they are due, and moreover, there will be vigilant monitoring of your pregnancy in the fetal medicine unit. For the vigilant monitoring, as I told you, there is one complication of twin transfusion syndrome, so we will do the scan every 2 weeks from 16 weeks onwards. At 20 weeks, there will be a detailed scanning of the baby to see if baby is having any structural problems. We will do your sugar screening around 24 to 28 weeks. Am I clear up till now, Sadia?
Oh, yeah, quite clear, doctor.
Mm-hmm. And after that, if there is a need, there will be repeated growth scans of the baby to see if baby is lagging
Your
the goal.
time up. Your time up. I am going to give you 2 minutes extra.
Mhm.
Start it.
So, yeah, so at 37 weeks, we will wait for a spontaneous onset of labor, and there are quite fair chances of normal delivery if the first baby is head down and there are no complications with you and your baby. At the time of the delivery, we will give you one-to-one support. Here, there will be continuous monitoring of both babies. We will provide you enough support. There will be two baby doctors, two midwives, and we will make sure that two cots are available. There is a quite possibility of early delivery as well. In that case, baby might need admission in a baby unit for a longer period. But we have advanced technology, and care is always available. At the time of delivery, there is a risk of heavy bleeding, so we will give you the medicines to reduce your risk of bleeding, and we will assess the need of blood thinning agents at the time of delivery and even in the pregnancy as well. Okay,
Okay.
and after delivery, we will provide you you enough support, reliable contraceptives, and help you in breastfeeding as well, because it is quite challenging at that time to tackle both babies. So we'll provide you enough support. I have given you a lot of information. I'm going to give you some information leaflets related to the twin pregnancy and fixing your next appointment with my consultant and writing back to your GP anytime if you have decreased movement of your babies or you have bleeding or any concern, you can see us without delay. Thank you.
Decrease movement. Now, actually, my movements will be decreased.
No, you are now 12 weeks, but after 20 weeks, you have to focus on the movements of your babies.
Oh, yeah. Thank you.
Thank you. Any questions so far?
No, thank you.
Thank you, ma'am.
Okay. Your own reflection.
Uh, one thing I missed. Mm, her assessment, I didn't mention anything, but in the last I mentioned we will assess the need for blood thinning agents in the pregnancy, and
Okay.
uh, mm, and the complications related to the baby I missed, that is twin anemia polycythemia syndrome, but this is rare complication. But twin transfusion syndrome, selective growth restriction. So in lay language, it was difficult for me to explain. I was a
What
little bit.
what you wanted to explain in low language, lay language?
Ma'am, uh, twin polycythemia anemia syndrome.
Okay, so track. You can just simply say that these pregnancies are always at means these are the highest risk pregnancy amongst twin deliveries, twin babies. Okay,
Mm-hmm.
highest and these are considered as a high risk pregnancy among twin babies. And
Yes,
they are at risk of complications. Sometimes there might be unequal channels or unequal blood flow, and the baby, one baby may get higher blood flow, the other baby may get lower blood flow. So that is known as TTTS. The other baby, because of this, the baby may have some growth constraint, and the other baby will be normal. So that is unequal growth distribution in both the babies, known as small for gestational age babies or IUGR babies in medical terminology. Some if this treated after treatment only there will be trap, not previously. If they
yes,
will be treated for this TTTS by laser techniques or something like that, then there will be a trap syndrome. Uh, as of now, we will not go in detail about that
right, ma'am, right.
because that is a trap is a very less likely. TTTS
Right.
and SJ, yes, you have to explain it here.
Yes.
Hmm?
And,
Okay.
I took time in expression of monochorionic diamniotic pregnancy. I took a little bit more time. That's why in the end, I felt that I didn't finish on the time.
Uh, you confused also. You were confused also.
Yes, ma'am. Yes, yes,
Okay. So what
yes.
is MCDA twins? Whether they're identical twins or they are not identical twins. The first basic question. And if you're getting confused at that point, it's difficult.
Ma'am, I think identical twins are mostly in
What about others? Please answer quickly. Okay. I want a quick answer about this question.
Identical twins, ma'am.
only.
Yes.
Okay.
Yes. It is monochorionic, dear. DCDA twins can be either identical, can be either non-identical.
Yes, ma'am. Yes, yes. This is my mistake.
Okay, so this is a very basic about it. Okay, so
Yes, this is my mistake.
okay.
Right.
Now coming to anybody wanted to give any comments? I will just any okay. I will just give you a feedback what I had noted from your task. Okay, there are a chance to improve because you had given me a wrong information somewhere. The similarly something like identical, non-identical. Apart from that, introduction was good, then you offered me an interpreter thinking that I am a different ethnicity. Very good point, very good situational awareness, I will say. Here it was not a GP letter, dear. See whether where there are GP letter. See, in the book it has been mentioned antenatal clinic, but I thought no, I need to change something so that you will have that idea about situational awareness. I may change my
Yes,
script, I may change something. Okay. So this is
yes,
only a scan. Okay, only a scan, and I am in the antenatal ward with my consultant. Why about consultant? I am with my consultant in an antenatal card.
okay, ma'am. Mm-hmm.
Okay. And I am here to discuss because you have a junior has done a sonography or ultrasonography, and we are here to discuss about that. Okay.
Yes, ma'am.
Simple. So this situational awareness, you need to know where exactly you are, what information you have, and what you are going to do now.
Yes, ma'am.
Hmm?
Yes, yes.
This has been missed.
Mm.
Then when I told you, dear, actually, when I told you that I am having this repeat episodes of nausea, vomiting, and I am admitted for that, and now again I am admitted, and then you said I am really sorry for that. I think it's very inappropriate when I find it very inappropriate because uh, these are the common symptoms of pregnancy. So rather than feeling sorry for that situation, You can ask in a different way. Do you need, is it controlled now? Are you on any medications? Is it controlled? Okay. She
Yes.
is having a troubled situation, but then do not feel sorry. Sorry, where you are going to feel, dear, here, whenever you are thinking that the patient is having something very bad, it's a natural normal process of pregnancy, so sorry might not be taken that positively. That is my opinion. People can have a different opinion regarding this. The way you uttered that, sorry, I'm sorry for your situation, so I had
Yes.
mentioned why sorry for being having a normal nausea vomiting of pregnancy. You can
Yes.
just acknowledge here, oh, so are you taking your anti-sickness medications regularly? This medication, you can continue taking this medication, they will give you relief and they are safe during pregnancy. Max
Yeah.
to max is two sentence because you wanted to acknowledge her yeah, symptoms. Am I right? You wanted to acknowledge her symptoms, you wanted to acknowledge her suffering. So saying sorry will not go properly in this situation. You acknowledge and you just address it by giving her a positive feedback, positive thing. Negative feedback will be sorry, but positive feedback here will be positive emphasis will be okay. So are you taking your medications properly? Please continue taking that, and they're safe. They're quite safe. Okay.
Yes.
Then very nicely you asked me how far I am from my pregnancy regarding booking blood test. Ultrasonography was already attached. You again asked me, I have done with your scans. This is again a situational awareness. You need not need to ask me. Okay, so this is good question. LMP you asked, general GP for surgery, allergy medicines. You asked me smoking and alcohol as a question together. So avoid it. You just ask me as a single question, one question at a time. Drugs need not be asked because when I am saying very simply and a straightforward station, you can skip it. Okay, then that's the reason when you asked me regarding a family history, twins, clots, any significant other family history, I had mentioned it very clearly. I didn't like that question, asking so many questions at a time. Okay.
Yes.
Very nicely, you had asked with whether it is spontaneous. Somewhere you acknowledge that whether it is a spontaneous pregnancy or planned pregnancy or somewhere something like medications. Very good. Means at least I have given you marks for that. Okay. Uh, Depressed? Why do you think I am depressed, dear, here?
Yes, ma'am.
Why
I
do you
thought,
think?
yeah,
No,
yeah,
no, no. No,
because
no.
patients are
If
very happy.
no, so you people are thinking in commonly that okay, she is at booking visit and you need to ask those questions. You have to ask those questions at booking visit, definitely. But if you are here to discuss the ultrasonography, then not needed, dear. Okay,
Yes.
okay.
Yes, yes, ma'am. Clear, ma'am.
Then uh, another thing will be okay, so when I explained you regarding family history of blood pressure and sugar, then you again asked me have do you screened yourself? Now it is your part to screen me for blood pressure and sugars. My family is having, but I am not having any you asked me in medical history, I am not having any blood pressure, sugar, but my family history is positive. So you have to see to it that now I need a aspirin, I need a diabetic test. So that is again a irrelevant question which I will be taking here. Examination is not needed. You offered me examination because per se this is at 12 weeks. What you want to examine me?
Ma'am, I thought because of vomiting, you have to check the weight again and booking weight, we have to
Yes.
compare.
I don't know. See, I'm controlled now. Am I better off? You can ask whether it is controlled or not. You
Yeah.
can acknowledge that in the beginning. Okay.
Yeah, the problem is this. Maybe I thought this is she's in the clinic, although she's admitted in the ward.
No, even if she is, see, in general, RCOG expects you to discuss only reports when they had come there to discuss reports. If they presented to you in the emergency, then at that time you are supposed to examine them.
Right.
This is in general concept what RCOG expecting. And they are
Right.
very, they are not happy with that examination part every time whenever we say that. Okay?
Right. Right.
Okay, so she has 12 weeks. She had just come to explain, see her, explain her. Okay. Uh, then okay, very nicely you draw means the diagram. Okay, so Did you check my knowledge? Am I aware about my report? Very important.
Ma'am,
This
you don't. I'm here to discuss my report.
that is okay. That is okay. But you are, in spite of all these things, in spite of all these things, your part is to check my background knowledge. Am I
Mm.
aware about the report? Did someone discuss the report with you? Because these questions will be in two domain: information gathering and communication with patient.
Right.
Okay.
Okay.
So
Yes.
do not forget, whenever you are saying something to the role player, do not forget to check their background knowledge. And why you want someone to be with me? Do you think, do you have a bad news?
No, no, good news.
Well, it's okay. If I, yeah, it's okay. If I means I means see, it is okay. I will not say something like that. But then unnecessary sentence will take your time. It will take a burden on your time.
Yes,
I
ma'am.
will be happy to share this news with my husband in the presence of my husband. Okay, in general. But here, if it is not needed in this format, this might be okay. This might be something where I need to. You will be losing on your time. You have to cautiously use your time. So the time duration was 5 minutes, dear.
Mm. Yes, ma'am.
Okay, so avoid that. Avoid that. 5 minutes you took complete time. Then the explanation were very good. Two kitchen, two rooms and one kitchen. You can use you whatever way you wanted to use. I'm not being. I'm not forcing anyone to use. But so far as use simple language, simple terminologies, and tell them what kind of twins they are having. And I wanted to know whether they are identical or same-sex twins. You confused me here, so I will cut your marks on applied clinical knowledge.
Yes, yes.
Hmm?
Right, ma'am.
Okay. So they are identical. Either they might be boys or either they might be girls, and they are from the same year, same origin. So they are having a single embryo which get divided into monochorionic. This you need not tell them, but yes, they are sharing after birth. That means they are identical and they are of the same sex. But they are divided. And this kind of twin pregnancies are considered as a high risk twin pregnancies. Anyway, twin pregnancy is a high risk twin pregnancy, which you had mentioned. And we need to book you under a consultant led care unit with a team of experts, which will include FMU specialist, anesthetist, pediatrician, and GP and midwife will be in loop. And she will be referred to a twin clinics. Somewhere
Yeah.
you have to use that terminology. Hmm?
Yes, yes. Mm.
Okay. Then complication and implication. So implications are different and complications are different. Complications, so implication means we are considering it as a high risk pregnancy. She will be requiring more frequent visit, more frequent scan, more frequent follow-ups, including into the community. So this is the implication of twin pregnancy. Hmm?
Right, ma'am.
Yeah, what are the complications? Whatever complications you had told me. So here explain ultrasound findings and its implication. Explain complications that you will recommend monitoring for during her antenatal care, and a certain address patient's concern. Okay, so one concern, we will go through the concerns specifically. Then you mentioned maternal complication. You mentioned babe fetal complications also. But you had the way you were explaining, sometimes you just go and because I'm going to put it onto the group, you just listen to that. Sometimes this, sometimes that, sometimes this, sometimes that. Okay, so those were your sentences when you were using that sentence complications. So rather than saying the sometime, you can just see that we have seen these babies or these babies are at risk of certain complications, sometimes like miscarriages, some concern with their growth, uh, early delivery, an ICU admission, and at some time, okay, occasionally or sometimes we have found that these babies are at risk of having a bad outcome. Okay, bad outcome you can say in the form of, you wanted to say, because these babies are at risk of stillbirth, these babies are at risk of NNDs complications because of this TTTS and SGA. Okay, so use once or twice sometimes, but not after every complication, sometimes this, sometimes that, because again you have to minimize your time. Hmm? So one sentence here. This has
Right.
happened in both the complication. You can listen to that sentence, what I wanted to tell you. So now, yes, so these are the complications, but now there are ways to minimize these complications. That doesn't mean that it will be completely eliminated, but we are going to minimize that complications. So you had offered me aspirin, vitamin D, anti-sickness medication. Please continue taking that. Then blood thinner, you had offered me very nicely. You had offered me breastfeeding support group, mental health specialist, post-delivery, vigilant monitoring in FMU, how frequently, that also you mentioned. And then you mentioned regarding a delivery. Delivery is not at 37. At what gestation we are going to deliver her? Anybody? MCDA. Knowledge.
36, ma'am.
Yes. Very nice, ma'am. Very nice. So she will be delivered at 36 weeks of gestation. Very nicely, you mentioned that the mode of delivery, if everything is normal, then we can allow her to go in, allowed her to deliver her vaginally by 36 weeks of gestation. We may offer her steroid if we are going to deliver her early. Then labor, you offered me everything. You offered me, means I had not mentioned in my answer key that two baby sites, two pediatrician. Yes, but very nice point which you had mentioned. Please mention that also. Along with two babies, means baby's heartbeat will be monitored with the help of two set of fetal heart machines. Two sets of probe with the help of machines. Epidural analgesia, continuous support, bedside ultrasonography. Then post delivery, she will be assessed for the risk of PPH, then active management of third stage of labor will be offered to her. You didn't mention active management of third stage of labor. Did you mention? I had mentioned only PPH. She is at risk of bleeding. And blood thinner will be offered to her after assessing the risk of VT. What that was your sentence. I didn't get whether you had mentioned about active management of third stage of labor. Anybody can comment about this sentence?
Ma'am, I told we'll give you medicines to avoid heavy bleeding. I
Okay,
told.
okay. So then actually, okay, okay. So PPH I had mentioned, and after that blood thinner, because you wanted to say that also point which you mentioned. Then I will take it as it is. Baby doctor will be assessing baby and contraception, breastfeeding, support system, VT assessment, post delivery will be offered. Cesarean section only indicated, or the first baby will be breached. Okay, in a separate different position. That is a role of cesarean section in that case. Mm, Along with that, you offered me a follow-up appointments when there will be movements. Why movements, dear? At 12 weeks, where I am going to have a decreased fetal movement, bleeding or okay. You just need to guide me regarding a PIL of MCDA. No, please say MCDA PIL, because there is a MCDA PIL. And support group, Tamba, Twin Trust. These are the support group. Okay. Now, when you are doing one task, dear, you can very easily remember it. Okay.
Yes,
And I'm
ma'am.
telling all of you that which task we are going to discuss today. So please ensure. So overall, a good prepare, good way of communication when it comes. But yes, you need, means okay communication. I will say you are having an approach to communicate with a role player, but then sometimes you are going in a some heavy direction. You must have acknowledged. You means you must have got it. What I wanted to say in your case, Shaista doctor. Okay.
Yes.
So those points you need to avoid. You need to avoid. Otherwise, you are good when it comes to when these mistakes will be minimized. Your communication will be seasoned. I do not have any doubt about that. Knowledge, you need to improve on knowledge. Because knowledge and patient safety goes hand in hand, according to me. So if your knowledge goes haywire, your patient safety goes haywire. Okay. So that is another problem. You explained me the complication TTTS and SGA. It was a little bit confusing, but okay, I got it. What you wanted to tell me. Communication with patient, communication with colleague. I will still give you pass. Okay, I will still give you pass. But applied clinical knowledge, information gathering also I will give you pass. Applied clinical knowledge and patient safety I will not give you full on full. Okay.
Yes.
A good task, but overall good task. So let's go through my answer key, what I have decided written here. Situation introduction, situational awareness. Congratulations can be said when I told you that this is my planned pregnancy. I was very enthusiastic when I told you that we were happy, means we are planning since last 3 years. Okay. What is the aim? USG to discuss about USG discussion. We are here to discuss the USG, but I am in the ward.
Yes.
Yes, I'm in the ward. Okay.
Yes.
Here also you can check my background knowledge whether I am aware about the report or not. Not okay. Then setting agenda you can make it as okay. So let's discuss the ultrasonography report and then we will go ahead with the care plan and address concerns. Okay. So that is our general plan. Uh, Now, by admitted because it has been HOPA details of pregnancy, planned IVF, spontaneous, folic acid, excessive nausea, vomiting, previous pregnancy. Nowhere it has been mentioned that this is a planned first pregnancy. If I am not telling you, but I told you that we are planning to have this baby since last 3 years. So it is my first pregnancy. You can assume that. I am not having any issue with that. By admitted is very important question which you asked me after I told you. So I will not be giving you marks for this family history of twins because you wanted to know and you asked me this question somewhere or the other way you asked me medical surgery allergy social history smoking and alcohol only I will ask here I will not take drugs actually because I find it a irrelevant question. BMI, blood group, and Jehovah Witness. Because she is at risk of bleeding, I will definitely ask Jehovah Witness here. Support, family history, concerns, management, and occupation. Okay. So, family history also you asked me. So information gathering, I gave you pass, okay, clear pass. Check her knowledge about her ultrasonography if you have not checked it previously. Twin pregnancy scan done by a junior doctor now needs to be done by an expert. Okay, so needs to be done by experts. So explain what type of twin she is having. So she's there isn't no lambda sign. Okay, that means okay, so this is sharing after but in two different sacs. So same sex baby that is identical babies. These are the identical babies, and these babies are known as monochorionic diamniotic babies in medical terminology. Okay, or in our clinical practice, we call these babies as MCDA. In short form, implication of these babies. These are the babies which are risk of complications and uh, implications and complications may go hand in hand. These babies at risk of complication, these babies at risk of more implications will be more frequent visit, more frequent follow-up, more frequent more medications which will be safer during pregnancy and uh, ultrasounds also more ultrasounds. Okay, then for mother the risk will be blood pressure, blood clots, so aspirin from 12 weeks 150 milligram, blood thinner if assessed and found high risk for the same, and blood pressure check from 16 weeks onward. Exaggerated symptoms of pregnancy like backache, nausea, vomiting, anemia, so iron supplementation will also be considered in her care, and extra check of hemoglobin at 24 weeks of gestation. There will be increased risk of intervention during labor, increased risk of cesarean section, operative vaginal delivery or assisted vaginal birth, and postpartum hemorrhage or bleeding after delivery. Uh, how we are going to minimize this? How we are going to minimize this? So more frequent visit, iron supplementation, additional assessment of hemoglobin at 24 weeks of gestation, blood sugar at 26 weeks due to family history, course and care in antenatal ANC. So this is a high risk pregnancy. She will be monitored in consultant-led care unit. Involves fetal-maternal expert, neonatologist, joined to care in the community by midwife, GP, and consultant. So booking blood test as of now we are going to dating scan has been done, but now NT and NB has not been done here. Okay, so it is NT NB scan. Okay, so by expert. This needs to be done by the experts who are skilled enough to do it into a twin pregnancies. Okay, and that too MCDA twin pregnancies. Now combined screen. Yeah, now just we will finish it off with this and then we will discuss. Now combined screen with NT-NB and blood test to see the screening for Downs. Okay, so this was my one question. How you are going to screen me for Down syndrome? So the similar way, the way we are screening for a singleton pregnancy, the similar way we are going to screen for a Down's syndrome. Okay, we are not going to have any different modality. Watch for BP, blood assessment, delivery by 36 weeks. if no complications. Okay, if no complications, and to avoid further complications in the baby, steroids will be given for lung maturity. Serial scan from 16 weeks to weekly to assess the risk of TTTS and SGA babies. Okay, I explained you TTTS. The who have joined lately, the TTTS is a complication. Means I'm just explaining way how I'm going to explain TTTS. Uh, T, in MCDA babies, that is a monoclonic diamniotic babies, they share a unequal blood supply. Okay, sometimes they're having an unequal distribution of blood supply, and that's the reason one baby will be having excessive blood flow, the other baby will be compromised of blood flow. And this condition is known as TTTS. In simple lay language, you can use that. And similarly, there will be a growth lag in one baby, and there will be excessive growth or a normal growth in other baby. And this condition is known as small for gestational age babies. And trap is a sequence which will be giving rise to condition, a trap condition after the treatment of TTTS. Hmm? We will aim for vaginal delivery if first wean will be cephalic or a baby head down position, and a breech or means if it is not a head down position or a buttocks, then it will go for a cesarean section. Monitor admission in consultant-led care unit, NST monitoring during labor, discuss pain relief like epidural, access. Always we will have access because these pregnancies are at risk of complications like bleeding post-delivery, needing an intervention, needing a cesarean section. So we will be having that IV line cited, ultrasonography, bedside to see, and one-to-one care. And very nicely you had mentioned two, 3 points actually, which I mentioned just now. Uh, yeah, two set of NICU neonatologist resuscitation tray and two sets of neonatologist will be added, which I need to add here. Okay, I am taking your permission to add it.
Yes.
Ma'am, folic acid 5 milligram, no, ma'am.
Uh, Folic acid 5 milligram. Yes, we can say
Well,
that.
she's already 12 weeks, so
Yeah,
I
it is okay. Yeah, that by this time the folic acid role has been already completed. Active management of third stage of labor to prevent PPH, blood and blood products will be handy, okay? Because she is at risk of blood, she is at risk of this situation, so it will be completed. Now, actually, I had not mentioned about pre post delivery, but if we wish, we can mention about post delivery. That is breastfeeding support group contraception. Anything else you wanted to address post delivery? Because I am just wanted to discuss these two in post delivery. Anybody wanted to add anything more?
assess for
Okay.
blood therapy.
No, so that we had explained. So we assume that every time, whenever we are means once only we have to say that we will be assessing you for blood clot formation. We had explained, we had assessed. But post delivery, these 2 points are very important. Breastfeeding support group and contraception, because difficult for her to take care of two babies at a time. So close the loop. That means you are going to document her care. We are going to give her PIL of MCDA twin pregnancies, FMU referral as of now, because we need to do means we will be not FMU, but her ultrasonography will be done by the experts, and if not, then FMU. Multiple pregnancy clinic for further care, it will be involved, and documentation of her care plan. Okay, got it?
Thank you so much, ma'am. Very nice.
Twin Trust and Tamba, these are the two support groups. Information gathering, I had given you clear past, spontaneous pregnancy, family history of multiple pregnancies, family history of diabetes and hypertension, previous admission and treatment for hyperemesis and nausea and vomiting, you had missed it. Her anxiety regarding avenue pledis screening. I wanted to ask you this question, but we were less on time, so I missed this question. And plans and offers to obtain admission records for review. Okay, so these two questions means one question you missed out, but still I had given you information gathering 2 marks or clear pass. Communication with colleague, MDT, discuss care plan with MDT, documentation, demonstrate when to refer to colleague, that is fetal medicine. Involved specialized clinic, that is multiple pregnancy clinic. So communication clinic, still I will give you 2 mark. You had missed out on 1 or 2 points, but involve these points, okay? Communication with patient also, I will give you clear pass. Explain ultrasonography. You explain me ultrasonography report. Complications, you explain me. Explain details of her antenatal care. Okay, you had mentioned me that. TTTS, selective FGR, trap, tap. Okay. Sequence and IUD of one twin. Introduction, addressing her concerns, explanation of condition in patient language, checking understanding. Okay, checking understanding very important, and PIL. Patient safety, minimize maternal risk, hypertension, anemia, fetal risk of VT, precautions, medications, assurance and safety, screen for gestational diabetes, a certain drug allergy, risk associated with this patient, especially MCDA, addressing all her concerns, identifying high risk, which means needs MDT, arrange home visit if needed, okay, offering appropriate investigation and ability to develop a clear management plan. So far as you had mentioned all those points in my answer key, but that 37 weeks and having this different two identical and non-identical, that is putting you at borderline patient safety, okay? Otherwise I would have, if those 2 points you would not have said, na, I would have put you clear pass, given you a clear pass. Screening for aneuploidy in MCDA twins, details of complications, timing of delivery, place of delivery, evidence of using green top guidelines, okay? So a clear task, a very good task. Just improve on communication skill, means you are having a good communication skill, but then there are certain repetitive sentences. Just listen to your recording, you will come to know what I wanted to say exactly, dear. Anybody is having any question? Anybody? Okay, so I will be stopping this recording.
Thank you so much, madam. Very nice session.